Okay, so Assalamu alaikum everyone. My name is Dr. Batul Zahra, and today, in partnership with Medical Hub Academy, I'm going to give the lecture on the topic adrenergic antagonist, which is also known as sympatholytics. So, as we have discussed in the last lecture, that sympathomimetics are the drugs which mimics the action of sympathetic system. Sympatholytics actually work in the reverse, right? So that's why they're called as sympatholytic, because they block or decrease the effects of sympathetic nervous stimulation, endogenous catecholamines, and adrenergic drugs. So guys, over here, you can see that there are two types of anti-adrenergic drugs. So obviously, as we have studied in the last class, that there are alpha receptors and beta receptors on the prosynaptic membrane. So when we study about the adrenergic antagonist, obviously the drugs will be going to working on both receptors. So drugs which are going to be alpha antagonists are again two types. They are either the selective alpha blockers or non-selective alpha blockers. So when we study about the selective alpha and non-selective alpha blockers, we can see over here that there are two types of drugs which are non-selective, and they are phentolamine and phenoxybenzamine. And when you talk about the alpha-1 antagonists, which are selectively working on only alpha-1, these are doxazosin, prazosin, terazosin, and tamsulosin. Over here, we can easily remember the suffix "sin", and whenever the suffix "sin" comes in any drugs, we can recognize that these are selective alpha-1 blockers. So we have doxazosin, prazosin, terazosin, and tamsulosin. Okay, next, we have beta blockers. And over here, we can again see that beta blockers are again divided into two types: beta selective blockers and beta non-selective blockers, right? So all the medicines which start from the letter A to the letter M, except the letter C, are the selective beta blockers. For example, over here you can see that all the drugs, okay, let me just annotate so that you can understand from here. Drugs starting from the letter A to M, okay, except C. These all the drugs will be beta-1 blockers. So acebutolol, atenolol, betoxolol, bisoprolol, esmoprolol, metoprolol, these all are beta-1 blockers. And when I say except C, so drugs coming from the letter C like cartiolol, carvedilol are non-selective. So basically what happened is that these drugs, okay, which are starting from the letter M to obviously Z, all of these drugs are going to be the non-selective beta blockers along with the letter C. So as you can see over here, labetalol, natolol, pambutolol, pindolol, propranolol, sotalol, timolol, all of these are coming after the letter N or from the letter N, right? So you can easily remember that these drugs are going to be beta non-selective blockers. And when I say except the letter C, Over here, you can see that it is catalol or carvedilol, right? Now, one more interesting thing over here, that you can see that there is an asterisk made in front of carvedilol and labetalol. So this is because these drugs will not only going to work on beta receptors, but along with that, it will also going to work on alpha receptors. So basically, these are the non-selective alpha and beta blockers both. So it will going to work on alpha 1 plus 2 along with beta 1 plus 2, right? So that's why they are, sorry, alpha 1 blockers along with beta 1 and beta 2 blockers. And as we all know that labetalol is most commonly used to control the hypertensive emergency, right? Okay, moving further. Over here, we will now study about the mechanisms of action and effects. So, okay, can everyone hear my voice? All right, so mechanisms of actions and effects can occur by blocking the alpha-1 receptors postsynaptic or by stimulation the presynaptic alpha-2 receptors. What happened basically is that these alpha blockers will basically either going to work on the alpha-1 receptors which are lying on the postsynaptic membrane so that they can block it and decrease the activity of the sympathetic nervous system, or they can stimulate the alpha-2 receptors which are present on the presynaptic membrane. And as we have studied in the last class, that the alpha-2 receptors are inhibitory. So if they were going to be stimulated, so obviously they will also going to reverse the action of the sympathetic nervous system. So obviously this results in return of norepinephrine to presynaptic site, activates the alpha-2 resulting in negative feedback, and decreases the release of additional norepinephrine. Now here are the therapeutic applications. Obviously, as we have studied in the last class, that our sympathetic nervous system when we're going to be activated in the time of stress, so our blood pressure, our heart rate, everything will going to be increased, right? And as we all remember that alpha receptors, especially the alpha-1 receptors, are basically present on the our blood vessels. So when the alpha-1 receptors will going to block these receptors, so they will help for the therapeutic application of essential hypertension by blocking the alpha-1 receptors on arterioles and veins, causing the vasodilation. It will also reverse the toxicity from alpha-1 agonists, and it will also going to work in benign prostatic hyperplasia. So when the alpha-1 receptor will going to be blocked in case of BBH, so there will be reduced contraction of smooth muscle in the bladder neck and prostatic capsules, which will eventually reduce the urinary urgency. Okay, so alpha blockers can also be used in pheochromocytoma, which is a catecholamine secreting tumor. And as we have studied in the last class, that our adrenergic drugs will going to work on both the catecholamines and non-catecholamines. Specifically catecholamines because our norepinephrine, which is the main neurotransmitter working in the sympathetic nervous system, is a catecholamine. So obviously when we're going to use the alpha blockers, so catecholamines, which includes norepinephrine, dopamine, and epinephrine, will going to be blocked. Then it also helps in the Raynaud's disease. What is Raynaud's disease? It is a peripheral vascular disorder characterized by vasospasms in the toes and fingers, leading to local sensation if cold and pain. What happened is that when these patients walk against the cold wind, they were going to have vasospasms in their toes and fingers. So we can use our adrenergic drugs over here as well. Now, as you all know that every adrenergic drug In fact, every drug which comes with some therapeutic effects also have some adverse effects, right? So when the adrenergic alpha blockers are decreasing the blood pressure, so obviously they will also going to have the side effect of orthostatic hypotension. So when there will be a blockade of alpha receptors on veins, reduced venous tone will occur, which will lead to blood accumulation in veins when patient assumes erect position, and reduced return of blood to the heart will lead to reduced cardiac output, which will decrease the blood pressure. And when there will be reduced blood flow to the brain, it will lead to lightheadedness and dizziness. So basically, whenever a patient is using an alpha blocker to decrease his or her blood pressure, and when these patients are lying in a supine position and when suddenly they try to stand up, there will be a sudden decrease in their blood pressure and they will start feel lightheadedness, they will feel dizzy. This condition is known as orthostatic hypotension. And now, another side effect of using the alpha blockers is reflex tachycardia. So, as we all know, that when there will be a blockade of vascular alpha-1 receptors, there will be vasodilation, right, to reduce the blood pressure. But in response to that, baroreceptors, which sense the change in pressure in our blood pressure, will going to be activated, and they will initiate a reflex increase in heart rate via the autonomic nervous system. So whenever the alpha blockers will going to decrease the blood pressure, our baroreceptors will increase the heart rate because they will sense the change in blood pressure and they will try to increase the blood flow to the heart. And another side effect of using the alpha blockers is the nasal congestion. Because again, if we remember our last lecture, so the alpha agonists are used in epistaxis to control the nasal bleeding. So if we are going to use the alpha antagonist, so obviously they will dilate the blood vessels in the nasal mucosa, hence causing nasal congestion. And then another side effect is inhibition of ejaculation, because when the alpha-1 receptors are going to be blocked, they can cause impotence and reversible. And this impotence is not permanent for life. Obviously, it's reversible because when the alpha blocker is withdrawn, so you can again become sexually active. And it can be a major reason for non-compliance, and most of the patients change the medication, right? So that's all about the adrenergic antagonist. And if you have any sort of question, please let me know. Thank you so much.